Hey, it's Roberto Miki again, and we've got another great hand question of the week. It's number 27 in our series of questions for medical students, residents, and fellows studying for the boards or in-training exams. Well, let's get right into it. It's a brachial plexus question, which the boards love to ask about. Which of the listed nerves originates from the root level of the brachial plexus? A. Musculocutaneous nerve. B. Long thoracic nerve. C. Suprascapular nerve. D. Medial pectoral nerve. Or E. Nerve to the subclavius. Well, here's your chance to pause the video so you can think about the question and answer it. The brachial plexus has two nerves that branch at the root level, the dorsoscapular nerve and the long thoracic nerve. The dorsoscapular nerve branches off of C5. The long thoracic nerve branches from C5, C6, and C7. The dorsoscapular nerve innervates the levator scapula, rhomboid major, and rhomboid minor muscles. The long thoracic nerve innervates the serratus anterior. Injuries to the long thoracic nerve classically result in scapular winging. Knowing where nerves branch from the brachial plexus is important in identifying the location and level of injuries clinically and in exam questions. So the brachial plexus is a daunting thing to memorize and to understand. And every drawing gives you different kinds of information. Like, for example, this drawing of the brachial plexus sort of gives you the anatomic location and what it would look like clinically. But from a clinical exam standpoint, it's difficult to recreate this and to memorize. Now, this drawing sort of maintains some of the anatomic relationships, but also, once again, is a little bit difficult to memorize and also to redraw for the average person. But it's a very good representation of the brachial plexus as far as understanding the anatomy and some of the nerve branching. Now, this drawing really helps you understand which nerve roots give innervation to which of the nerves. And I think that color coding is really useful in getting a basic understanding of which nerve roots help you with each nerve. But I think that for a basic understanding, it's probably better to go to a sort of a line drawing, and I've sort of simplified the brachial plexus into this line drawing so you can understand the basic components. And basically, the brachial plexus is composed of 5 nerve roots: the C5, C6, C7, C8, and T1 ventral rami. And there are about 50% of the time where the C4 or T2 may also give a small component of innervation, but the basic understanding should be the C5, C6, C7, C8, and T1 root levels. The ventral rami. Remember, the dorsal rami give innervation to the spinal muscles, and so the ventral rami is what we're really interested in. So once again, it's the root levels C5, C6, C7, C8, and T1 ventral rami. These then go on to become trunks, and the C5 and C6 roots merge into the upper trunk. The C7 continues as the middle trunk, and the C8 and T1 roots then merge to become the lower trunk or inferior trunk. Now, each of those trunks divides into an anterior and posterior division, and the posterior divisions, all 3 of them, merge to become the posterior cord. The anterior division of the upper trunk and middle trunk then merge to become the lateral cord. The anterior division of the inferior cord goes on to become the medial cord, and that's depicted here. At this point, we start naming definitive nerves. And so off the roots, you have the long thoracic, you have the dorsoscapular nerve, which we talked about in the question, and then you start forming off the upper trunk, you start forming the suprascapular nerve. Off the upper trunk, you also form the nerve to the subclavius, which is coming off the C5 and C6 trunk. And off of the posterior cord, you're going to create the inferior and superior subscapulars and the middle subscapular nerve. Middle subscapular nerve is also known as the thoracodorsal nerve. You also form off the lateral cord the lateral pectoral nerve, and off the medial cord you form the medial pectoral nerve. And then you also form the medial brachial and medial antebrachial nerves off the medial cord. Finally, off the lateral cord, you form what's the definitive nerve, or the definal nerve is the musculocutaneous nerve, which then also becomes the lateral antebrachial nerve. Off of the posterior cord, you form the axillary and radial nerves, and a branch from the lateral cord and the medial cord merges together to form the median nerve. Now, the lateral cord becomes the ulnar nerve. This basically depicts the complete brachial plexus and all of the nerves that come from it. And so if you memorize this drawing, you have a very strong understanding of the brachial plexus, although not a complete one. If you want a more complete and intense sort of description of the brachial plexus and all of its nerves, I would suggest this YouTube video. It's by Dr. Israel Alfonso, and it's a very comprehensive lecture on the brachial plexus. But get back to the question. Which of the listed nerves originates from the root level of the brachial plexus? That's B, the long thoracic nerve. And it is not the only one, but it's one of the two. And once again, the other one is the dorsoscapular nerve. Well, I hope you enjoyed the video. I hope you learned something. Remember to like and subscribe so you can continue to support this channel. We'll hope to see you on the next one.